There's your pointer.
Thanks. Thank you, Jose. Thank you, Lowell. Thanks for inviting me. It's interesting that I was told to give the anatomy and nomenclature of the venous system in under 5 minutes, and Lowell has informed me that after 22 years I still don't understand the anatomy of the venous system myself, so I'll do the best I can to point out some anomalies and disclosures. It's important to understand the anatomy of the venous system because the knowledge of the anatomic variants as we start to look at these patients is going to help us govern how we approach these patients. And we're all familiar with the general anatomy and the expected anatomy, but try to correlate the anatomy that we see, that we know the patients can demonstrate with the varicose patterns, and then that helps us to determine the source of the pathology so that we can treat the underlying source rather than just kind of rip the veins out the way we used to in the old days. The saphenofemoral junction, of course, everyone is familiar with the zone of influence of the great saphenous vein, but it's important to also understand the tributaries at the saphenofemoral junction, and you can see them listed in the red box, and that those branches can either be incompetent in and of themselves with incompetent valves deriving varicose veins in the groin region, or can be varicosities themselves. And you can see that by doing a simple ablation of a great saphenous in this sort of anatomy may not treat the underlying pathology, and you may be left with a patient with varicosities. So you need to be aware and do a thorough duplex ultrasound evaluation of the junction and try to determine what's going on up there. And so this is what we're used to seeing, which is terminal valvular incompetence, complete terminal valvular incompetence with reflux at that valve extending down through the great saphenous system, and that's the normal expected variant that we see in the common patient. But here's a patient that has a partial terminal valvular incompetence, and you can see it's diagrammed here where we can see this valve closed by duplex ultrasound, yet there is still reflux down the great saphenous system. Here's a patient that does have a competent saphenofemoral junction. You can see at the top at the saphenofemoral junction the terminal valve is in fact competent, but there's reflux down through the circumflex and extending into the saphenous system. And again, to try to understand the anatomy is going to help us to understand how we best can manage this patient with that variant of reflux that presents this way with the anterior varicosities extending to the lateral side of the thigh and knee. And here's a patient with anterior circumflex reflux, but actually coming down and refilling the great saphenous system. And again, to understand this anatomy is important in recommending treatment, because if we just treat the upper thigh, the great saphenous in the upper thigh, you can see we're probably not going to